Hi, this is Curtis Alexander. I'm a pharmacist. In this video, I'm going to be reviewing the prescription medication Paroxetine, also goes by the brand name Paxil. It's been out on the market a long time. It's primarily used to treat depression, although you can see it for other things like anxiety, OCD, panic disorder, even post-traumatic stress disorder. So it's used for a number of different purposes, comes in a number of different strengths, but in this video what I really want to focus on how it acts in your body, the side effects that you're likely to see, the side effects that you could see. They're much more rare, but something you want to keep an eye out for. And at the end of the video, I'm just going to give you basically what I see as the pros and the cons of the medication. So, like I discussed, we already know the uses. So what does Paxil or Paroxetine do in your body? So it is a class of medications, which I've talked about a number of these before, from Zoloft to Trintellix. Trintellix is a little different, but it's a selective serotonin reuptake inhibitor. So most of your serotonin in your body is produced actually in your gut. 90 to 95% comes from your guts. And so when the serotonin is out in your system, your body has a natural mechanism that will reuptake serotonin to keep the levels basically stable. What Paroxetine does, what the SSRIs do, is they block that process. So there's less of the serotonin being taken back up into the body, so your blood levels will actually rise. Now, this can lead to some benefits. It can also lead to some downsides. And right now I'd like to hop into some of the downsides. Before we get there, let's talk about dosing. So I always encourage people start at the lowest dose possible, which for Paroxetine would be 5 to 10 milligrams a day. It can go upwards from there. It needs to be done slowly. And keep in mind, when you start taking something like this, it doesn't start working right away for the vast majority of people. It's going to take 2 to 3 weeks. You may notice some effects, more likely 3 to 4 weeks. And then you want to go up slowly if that's even needed. In some cases, it's not. There is an extended release formulation of Paroxetine. That is not something that you can interchange the immediate release for the extended release on a milligram for milligram basis. So if that's something that you want to talk to your doctor about, keep that in mind. So jumping back to the side effects. So one of the most common ones that we can see is excessive sweating. We see that roughly 5 to 14% of folks can see that happen. We also, Paroxetine is one of the medications. This is SSRIs across the board. You can see sexual side effects. The most common that I see is a decrease in libido. This tends to be more common in males, but this occurs anywhere from 4 to 15% of folks will claim or state that their sex drive has gone down. We can also see ejaculatory disorders. That's 13 to 28%. The ranges vary because of studies, dosing, those sorts of things. Now we start getting into some of the gastrointestinal side effects. Remember, we talked about serotonin primarily being produced in the gut. So when we're blocking this process, we can have stomach side effects. You can see constipation. You can see diarrhea. Why both of them, we don't really know, but you can see it. So you're looking at anywhere from a couple of percent upwards of 18%, and again, that kind of varies depending on diarrhea or constipation. You can get nausea. It's fairly common. Upwards of a quarter, 25% of people can see that. We do see dizziness and drowsiness, roughly 3 to 24%. So again, we have a range there. And then weakness, upwards of 2 out of every 10 patients will complain of weakness. All right, now some of the more rare side effects that you can see. I'm not going to go through them all, but keep in mind, serotonin is a hormone in your body. When you mess with a hormone, it can have downstream effects. One of those is you can have frailty fractures. So if you're older, 50 or older, you can start increasing your risk of fractures. If you have a bleeding disorder, it can cause clotting disorders. So some of these more rare things that we can see, like serotonin syndrome, just keep in mind that that's why you start as low as you can. You're blocking serotonin, it's a hormone, so it does have downstream effects. Now the ones I just mentioned, they're rare. They're far from common, but it's something to keep an eye on. One of the more common questions I get is, can Paroxetine, can Paxil cause weight gain? In studies, we see it in roughly 1% of people. In my experience, it's almost the opposite because, again, people can get nauseous from it, so they tend not to eat as much. Also, we can see constipation and diarrhea. So usually the problem is not weight gain. We can tend to see people even lose some weight when they're taking Paroxetine. And actually another side effect that you can see is a decrease in appetite, anywhere from 1 to 10% of people. So with that being said, what's my overall take on Paroxetine? It's been around a long time. So some of the pros, it's been around a long time. We have a lot of experience with using it in folks. It's relatively inexpensive because it's available via generic. So those are some good things. Some of the cons that I don't like, I have a lot of complaints about sexual side effects. Like I said, another pro is it doesn't seem to cause weight gain, but the sexual side effects is troublesome, as are the GI, the gastrointestinal side effects. So, but I will say that you're going to see that with a lot of the SSRIs. You can kind of nitpick that one is maybe better than the other, but I've had some people respond really well to Paroxetine, some people not so much. Sometimes you just have to try them and see how you do. So I hope this video was helpful. If you've taken Paroxetine or Paxil, know somebody who has, please post in the comments. It helps me, it helps other people learn from your experiences. So I always appreciate that. I may not respond to every comment as I do more videos, but I appreciate you posting that, and I promise I read all of them. So again, hope the video was helpful, and until the next one, this is Curtis Alexander. Thanks.